Michelle, I wanted to come back to you on this forum shopping, this sort of maniacal, totally detached from public opinion, even the public opinion of Republicans in America, effort to strip away access to health care for women all across the country by finding this one extreme judge in Amarillo, Texas. How do we solve for that not happening to women in this country?
Well, it reflects something that Dahlia wrote about right after the Dobbs decision, and that there's a type of lawlessness that is now a part of the American judiciary that has infected it. This is part why there is such a low approval rating of the United States Supreme Court. That is that Americans have lost confidence and faith in the dignity and legitimacy of our courts, the perception that they've turned into or leaned into engaging in politics rather than doing the work of the judiciary. And in these days, to your point, it's going to be hard to work around. As you mentioned, this is a type of forum shopping that you described so well, and it's very likely that we will see more of this. I mean, the former president, Donald Trump, made clear that he only wanted to appoint judges and justices that would seek to overturn Roe v. Wade, Planned Parenthood v. Casey. He went so far as to say that he wanted to see or would be willing to see women being punished who wanted to have abortions. And so we could look at Texas, but we could also look at South Carolina, and we can look across the country in South Carolina where there's been a call for the death penalty for women who want to be able to terminate a pregnancy. When we see a drug like this become so deeply politicized, when in fact it is incredibly safe, and in a country where a woman is 14 times more likely to die by carrying a pregnancy to term than by having an abortion, then we really do see the lawlessness that Dahlia wrote about. We see the cruelty behind these kinds of laws, and we see judges leaving the judiciary in such an undignified path. And it is incredibly disconcerting, not just with regard to this particular drug, but vaccines and what more that might come after this, including transgender affirming medications or any kind of medication that a group now finds to be offensive to their sensibilities.
Yeah, I mean, Dahlia, it's not without a political consequence. The Supreme Court has become a political dead weight on the right, where it once animated the right, it is now a liability. 58% of Americans disapprove of the United States Supreme Court. All of the ballot initiatives went for the side that favored choice, not for the anti-choice zealots who were behind this movement. What is different, and I think what people understand, is that Roe and Casey were not decided by justices appointed by Democrats. They were decided by justices appointed by Democrats and Republicans. That's why it maintained 67% approval through much of our modern political conversation. And I have tried to straddle the today tragedy for women who are having to deal with this. But there is a longer-term tectonic shift in the politics of the Supreme Court that is all ominous for Republicans.
It's true. And I think in some sense, if you remember all the way back to June when Dobbs was decided, we were promised, both in Justice Alito's majority opinion and in Justice Kavanaugh's concurrence, that this was going to go back to the states, right? And this was federalism and this was states' rights. And the court was just going to get out of the way and this problem was going to kind of disappear because it would all be decided as it properly should be in the states. And suddenly we have a nationwide ban that could happen, an attempt to do something nationwide, and medication abortion count for about 54% of abortions. So this is really, I think, in some sense, puts to the lie the notion that it was going to be enough to send this back to the states. It was never enough. We are heading inexorably toward, personhood amendments and earlier bans. And to Michelle's larger point, I think it's also worth saying we are heading toward more and more cruelty and punitive measures towards the pregnant people who will suffer. And so this is not a kind of a clinical, dispassionate, the court somehow asserting a principle about state rights that doesn't affect anybody. People were smart enough to see then, and certainly smart enough to see now, that the end game here is not just abortion, but also contraception. And as Michelle Michelle says, also, other rights that are embedded in these notions of privacy and bodily autonomy. So I think you're quite right. I think the court has been on a collision course with public opinion since the start of Dobbs. And what's clear is that renegade judges and renegade groups that don't care that the court is on a collision course with public opinion are nevertheless doubling down, and doubling down again.
Dr. Patel, let's go back to the real world impact for women today, because our politics are painfully slow to catch up with these catastrophic policies and legal decisions. Tell me the state of play right now for access to medical abortions, and then tell me what happens if this is, I don't even know what we call it, unapproved, disproved, taken FDA approval, withdrawn, which again, our research suggests that has never happened before for a non-medical purpose. No non-medical case has ever been made for any drug, and that this drug is safer than none other than Viagra and Tylenol. So they're the medical facts. Take me through the reality, Dr. Patel.
Yeah, so you're right. There is no phrase that you can easily call up because this just doesn't happen, but it would be basically an injunction and deeming that approval does not stand. So what we would have is no ability to actually use the drug, prescribe the drug. I've actually talked to doctors who said they're going to try to consider stockpiling it in the event that we have the injunction moving forward, as many of us expect. But the reality on the ground is one of confusion, especially if you're in many of the states right now where doctors could have criminal or civil or any sort of penalties weighed against them, even if they're counseling women for how to safely seek an abortion. And so that, on top of the fact that Biden administration recently changed and made it easier because it is so safe to get medication abortions in retail pharmacies. That's a good move. But all of this, to your point, is happening at the same time. So on one hand, the FDA, the Biden administration, is saying this is not just safe and effective, but since 2000, we have had 23 years of data on the safety of this drug, and you should be able to get it at a retail pharmacy only if you live in a state that allows you to do it, which is something we've talked about. That's the reality on the ground today, that we're preparing for expanded access. And at the same time, ironically, you have doctors who are talking about stockpiling this very drug because we don't know what would happen in Texas that could have national ramifications. And I'll just offer, I can't help but the policy person in me, people are talking about accelerated approval. This was a fast approval. I just want to make something clear. There was a 54-month review period for this drug when every other drug of the year of 2000 that year had a median of 15 months for approval time. So anyone who wants to talk about this being rushed or accelerated, they need to get their facts straight.
Well, and I wouldn't worry about the right arguing in good faith. It is some of the same people who were giant fans of ivermectin and whatnot. But I think the facts, I think the effort to rewrite the history of the drug's approval is part of the gaslighting on the right. And what's interesting to me, Minnie, is it's necessary not just sort of on Earth One, where 67% of Americans are disturbed by the overturning of Roe, but it causes problems on Earth Two, where even Republicans, 93% of all Americans, which is a vast majority of Republicans, oppose these extreme bans that eliminate exceptions for life of the mother. 87% of all Americans oppose the extreme bans which eliminate exceptions in the case of rape and incest. And the extreme anti-choice movement has now grabbed the wheel. They have their own keys in the ignition, and they've kicked out the rest of the right wing from the car. They are driving these policies, and that is exactly how we ended up here today. I wonder how you make sure that people know that this isn't a right-left. This is the fringiest part of the right against the rest of the country.
You make such a good point. And the way that we do that is we're just very clear and unequivocal about who the bad actors are in this situation. That's why it's so important. There's been in-depth press coverage on who this judge is, who this organization is, their illegitimacy, their lack of ties to Amarillo, the conversation on forum shopping. But more importantly, it's really important for us as advocates to drive the contrast between states where we have reproductive freedom champions. Look at what just happened in Michigan. Look what's happening in California, Minnesota, Colorado, where they're enshrining and protecting and expanding access. And what's happening in places like Texas and Florida, where we're seeing rapid decline and really scary consequences for those citizens, where it's a really dangerous place to be a pregnant person. That's one way that we can drive that contrast and tell the story of what's happened to the radical extreme right and how they've completely captured their party and the actions. And look, we're waiting for reasonable, moderate Republicans to stand up and protest the actions of their colleagues. And I'm yet to see it happen. And until that happens, we're frankly perfectly fine highlighting the extremes and making sure Americans understand this is what's going on in this country.